Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined today by our Metro Health Director Claude Jacob, along with our City Attorney Andy Segovia and District Attorney Joe Gonzalez. Welcome back to our COVID-19 briefings at 6:13. We did think we were done with these, but as you know, the Delta surge is very serious, and we want to give you updates on what is happening in our community. So let's go into tonight's update. First of all, the City of San Antonio and Bexar County today filed a lawsuit challenging Governor Greg Abbott's authority to suspend state laws that give local officials the needed authority to cope with an emergency. The lawsuit was filed in the State District Court in Bexar County and asked for a temporary restraining order to prevent enforcement of the governor's latest emergency order. I'm pleased to share that the court granted the temporary restraining order. To that effect, Bexar County Health Authority Dr. Junda Wu has issued a public health directive for the upcoming school year, and that means effective immediately, starting tomorrow. The directive applies to all public schools from pre-kindergarten through grade 12, effective immediately. Again, mask wearing. And Claude Jacob, our Metro Health Director, is going to go into what's in the order in just a moment. But first, let me give you an update on where we are with COVID numbers in our community. COVID-19, as you know, is surging, causing severe stress to our local hospital systems. We are in a worsening situation with the community's overall COVID-19 risk at severe. The region's positivity rate now is 21.4%. For context, the positivity rate was 24.2% last July, 23.2% last winter, but just a couple of months ago, we were below 2%. So it has skyrocketed, and we are getting into a very dangerous territory. As a reminder, we have a complete list of testing sites available at covid19.sanantonio.gov. You can also call the COVID-19 hotline by calling 311 and selecting option 8. Finally, let me get into case numbers and hospital data. Today we're reporting 1,914 new cases of COVID-19. Our 7-day moving average has jumped to 1,353. 99% of the new cases can be attributed now to the Delta variant in Bexar County. We are also sadly reporting 2 deaths. We've lost 3,643 of our friends, neighbors, and loved ones to this virus. Please remember them. Keep them in your prayers. We have lost too many of our friends and neighbors throughout this pandemic. Finally, there are 1,242 patients in area hospitals, 189 new admissions in the last 24 hours. That is a very, very high number. 314 patients are in ICU, 193 are on ventilators, and 87% of patients in area hospitals, as noted, are unvaccinated. Let me turn it over now to Judge Wolff.
Well, thank you, Mayor. I'm wearing my bandana, one of 25 that have been given to me to celebrate the victory that we had in court today. I can't tell you how important that was. Rather than the mayor and I taking and doing directives that conflicted with the governor, we instead went to court, won a great victory today, and now we're in the issuing emergency orders. The health director, Dr. Wu, has issued one for public schools. We're backing it up with our emergency orders, and then we'll be entering emergency orders today requiring in any county facilities, regardless of where they are, in the mayor, in any city facilities, that you've got to wear a mask to come in, and that all employees have got to wear a mask. So we're on the right track now, but I must say it's very dangerous times. I don't think I can emphasize strong enough how dangerous it is, particularly for those that are unvaccinated. 87, 88% of the people in the hospital are people that are not vaccinated. Those numbers are climbing every day. Today we're at 1,247. We reached a high of 1,267 in the summer. We're going to exceed that, and we will probably, in all likelihood, exceed the 1,520 that we had during the winter months in the second surge. It's going to be around here for a while. It's not going anyway tomorrow or the next day, and our curve is still steep. So there's 2 major things we can do: get the vaccination, and wear a mask. And so we're taking steps to protect our school children. They're vulnerable. In the last month or so, the number of children going to hospitals has doubled across the nation. Everybody's vulnerable to this. We have one 11-month-old baby in our hospital at Bexar County Hospital District with COVID. So children are at great risk. And so now having the authority, at least for the short term, hopefully for the long term, to require masks in schools will help protect the children, help protect the teachers and administrators, and help protect the parents when the child comes home, not bringing the COVID to them. So we hope that all of you will be supportive of this and that the school districts and the superintendents will administer and enforce this. There are 17 school districts in the Bexar County, so we're going to need their help in doing that. The sheriff's office, I talked with him today. He's going to be enforcing it. I know the police department will too. So we got to start here, but we really got to pull together and make this work.
Great. Thank you, Judge. Let me turn it over now to our Metro Health Director, Claude Jacob, to explain a little bit more about what's in Dr. Wu's health order today.
All right, thank you, Mr. Mayor. So here's what's in the order. So universal indoor masking. Schools shall follow the Centers for Disease Control and Prevention, the CDC's recommendations for universal indoor masking and require all students ages 2 and older, staff, teachers, and visitors to K through 12 schools, regardless of vaccination status, to wear a face mask indoors. Regarding close contacts, schools shall notify the student's parents or guardians when the school learns that a student was in close contact as defined by the CDC, the Centers for Disease Control and Prevention, with a COVID-19 positive individual on campus or during a school-related event. Keep in mind that unvaccinated individuals who are determined to be in close contact with a COVID-19 positive person shall quarantine for 14 days after their last contact with a person who has COVID-19 as recommended by the CDC. Students, staff, teachers, and visitors shall remain off campus and not attend any school-sponsored events during their quarantine period. Again, to learn more and read about the order itself, go to covid19.sanantonio.gov.
Great. Thank you, Claude. And as has been the case throughout this pandemic, the city and the county are working together to keep our community safe, and that includes our loved ones and our young ones in schools. So with that, District Attorney Joe Gonzalez, as well as City Attorney Andy Segovia, Claude Jacob, our Metro Health Director, and myself and the judge are available for questions.
Judge or Mayor, what kind of conversations have you had with the school district leaders about this? Did you catch them off guard that this was coming? And also, what are the consequences for those schools that refuse to follow this mandate?
Well, first of all, the order has been cleared by a judge that we can do this, so it is a mandatory order, not a we hope you do it. If you listen carefully to Mr. Jacob, those were shells, not may. Shall have to do this. So we know that there's a practicality method of ensuring that happens. It relates not only to the superintendents but to each teacher to monitor their classes. I'm sure we're going to have their support. I know that the San Antonio Independent School District was pushing it hard. All school districts were. And so I think they're going to be very supportive of this.
And I'd add also, the judge and I, along with Metro Health, convened our superintendents a couple of weeks ago to let them know how serious this whole situation was. I believe Metro Health has also been in communication with districts today as well with the new order.
Are there any consequences for those that don't want to do this?
Well, again, the mandate, as was issued, is a mandate. And the expectation, obviously, is that there will be compliance. The best way to comply, frankly, is if you want to go to school, you'll have to have a mask on. If you want to be participating as a teacher or any other staff member, you have to have a mask on. So that's the best mechanism in terms of enforcement.
But it doesn't sound like there's a consequence either for the school district or for the students' staff.
Well, that's one where we'll probably cross that bridge if and when we get to it. Again, the hope is that the mandate is taken as a mandate and that compliance is one where all our school districts will willingly comply with the mandate.
There's plenty of enforcement tools for the superintendents and the principals to enforce this. All they have to simply say, your child's not going to be able to stay in school. If he doesn't have a mask on, if a teacher shows up without one, they have to put it on. They have all the enforcement tools that they need to individually do it.
We got We got a statement from the governor's office a little earlier. I want to read it. It says, Governor Abbott's resolve to protect the rights and freedoms of all Texans has not wavered. There have been dozens of legal challenges to the governor's executive orders, all of which have been upheld in the end. We expect a similar outcome when the San Antonio trial court's decision is reviewed by the appellate courts. That statement sounds very confident that they're going to get their way and have that mask mandate with the injunction revoked. I just want to hear your thoughts on that.
Well, I don't know if they're going to get their way. Judge Ortega will make a decision this coming Monday whether to do a permanent injunction. If they appeal, they'll be going to the Fourth Court of Appeals, then eventually to the Supreme Court. If the governor really wants to push it that hard and cause this much danger to people, then I hope they realize what a tremendous liability is to this state and the danger he's putting our children in. Joe, do you want to add anything to that?
Well, I think it's important to note that this was an effort at collaborating between the city and the county to do something. We said for a while now that the governor ought not to impede the local authorities' ability to keep this community safe. And that's exactly why we took action. We were very pleased with Judge Arteaga's ruling today. We're taking it one step at a time. Monday is going to be the hearing on the temporary injunction. We hope that she makes it a permanent injunction, and we'll set it for the trial on the merits. But right now we're taking it one step at a time. We believed we had to act. We did act, and fortunately we got the result we were looking for. So we'll keep moving forward.
And let's be real clear about something. No one's rights or freedoms are being infringed by ensuring that school districts and public health authorities can offer the mitigation efforts needed to comply with the CDC guidance to keep our kids safe and alive, and to make sure that schools are safe environments. If folks are interested in opening up this economy, the best thing we can do is make sure that schools are open safely and that we get back to a safe environment for all of our children.
Mayor, Judge, do you have any plans to issue a county-wide mask mandate as done in the past before the governor had taken away that authority? It's something you all have been asking for months. And if you don't plan to issue one, why not?
I guess the attorneys are. Andy, you want to add that? What you think we can do and can't do?
Well, the judge's order today talked specifically about mask mandates, and we did talk about what immediate actions we would take at our hearing. And we articulated to the judge the very thing that it's in Dr. Wu's order, and that's in orders issued by the city manager and by the county judge, which is mandating masks at facilities and for employees. Our view is that hopefully we can get through the hearing next week the full ability to restore all the rights that the city has, that the county has, that the health authority has, so that we can do whatever the pandemic requires us to do. And it's a very fluid situation, and so what we're asking for is that we have the tools to appropriately react and do what is needed to be done. And as always, we'll rely on the health experts to tell us what that is.
You know, and I think our pleadings and the judge ruling on them, I think we've got a very good legal case. If judges carefully look at it, I don't see how they can uphold what the governor's doing based on the information we've got in the pleadings we have and the evidence and the past judgments. And so hopefully they will recognize that.
Mr. Jacob, how has the Delta variant changed how we get to herd immunity now?
So the question regarding the Delta variant, so just know that this virus is a lot more infectious, a lot more contagious than the original strain. So it's been said, and again, we've looked at studies that show the original strain, if you were COVID positive, maybe 2 or 3 individuals would catch the virus from the index case. But recognizing that the Delta variant is a lot more contagious in that 8 to 9 individuals can contract the virus. So what we've seen over the course of the last few weeks, we've been talking about the doubling effect of our positivity rate from the last few weeks. We've talked about the incredible pressures on the local healthcare system. We are mindful of what happens between the holidays, the intervals, between Memorial Day to 4th of July, between 4th of July to Labor Day. We know that with back to school, we have a number of children under the age of 12 not vaccinated. So at the end of the day, this Delta variant, it is the most dominant strain that we're seeing in our genomic sequencing. So we're showing 9 out of 10 cases that should reflect the Delta variant. So it has been the game changer. We're seeing breakthrough infections across the country. And so we just want to make sure that out of an abundance of caution, making sure that we can protect parents, we can protect students, we can protect employees, including teachers. So that's why we're really talking about what we're seeing now. So again, taking into consideration that the situation continues to evolve. So that's what we're working with these days.
Are there any consequences for you as leaders, in your case, Mayor and Judge? For example, he's threatening to withhold monies to school districts. We know that the city or the county receive state money. Can he withhold monies if he decides to do so?
I would ask our attorneys, but that would sound an awful lot like retaliation.
Of course. I mean, he's trying, he will retaliate more than likely.
Again, what we're trying to do is make sure that our local public health authority and our local authorities, the judge and I, have the ability to protect our communities in accordance with CDC guidelines. We have been attacking this pandemic with the guidance of our public health professionals from the very start. If that's a problem from the governor, then I think he's abdicating his main responsibility, which is to keep Texans safe.
Let me just point out the hypocrisy. When this thing started, the pandemic started, the governor supported our right to have a mask mandate. He even put in place a mask mandate. He even closed up non-essential businesses. Then he went the other way. Then he came back and put in a mask mandate. He put in provisions when our hospitals are over 15% to do more, and they're over that now. So everything he's telling you today, it contradicts what he did 12 months ago. He's just gone, back and forth. What does he really believe? I don't know what the hell he believes, but he used to believe like we believed.
In terms of what the governor can withhold, it obviously depends on what monies we do receive, either from the county or the city. Those are dictated either by law or by that program or whatever the grant program is that we receive them. And so whatever rules that apply to that program and the receiving of funds, the state would still have to adhere to that. So it's not completely up to his discretion.
In your conversations with all of the ISDs in the county, have there been any leaders that say we are not going to follow the local mandate and we're going to stick with what the governor is saying?
We have not heard that.
Are you talking about since the TRO was issued? No, I haven't had those conversations, but again, the effect of the TRO is that now the Public Health Authority has the jurisdiction to issue those public health directives.
Question just to make sure I understand this. On Monday, we have a hearing over the temporary injunction, but it doesn't end there, right? If the judge issues a ruling to give a temporary injunction, that doesn't mean we have the authority forever to continue to issue mask mandates.
Well, we hope it ends there. But to answer your question, yes, we have a hearing on a temporary injunction on Monday. When that's granted, I'm being confident here, when that's granted, the governor will have the ability to appeal that to an appellate court, but that would be the next step. Short of an appeal to an appellate court, the next step would be a trial on the merits. But as we await that trial on the merits, if we do get that temporary injunction, that'll stay in place until there's a trial.
And if it goes to the appellate court and makes its way to the Texas Supreme Court, I think we might be able to guess, if it gets overturned by the Supreme Court, because that's a possibility. Are y'all worried about the efforts then being somewhat fruitless? Like we hit the top and then we can't do anything?
Not at all, because every day that we can initiate and implement a mitigation step like what we just did in terms of masks, every day that we can do that is a meaningful thing in terms of attacking the pandemic.
Looking at hospital numbers, can you tell me how many ICU beds are available? I was reading earlier, the greater Houston area only had 27. The state only has more than 300. I'm just curious what that looks like for Bexar County.
Well, we have 570 some odd ventilators available. So if somebody reached that stage, we've got plenty of those. And what's happening with a lot of the ICU beds, sometimes a nurse has to take care of 2 patients to be able to do it. Many times you have to convert a regular hospital room into an IC unit. So they don't have a specific number on there because they have ability to change and to do different mechanisms with it.
I'm going to switch back to the injunction on Monday really quickly. If for some reason that does not go the way you all are anticipating it going and it gets overturned, where do you go from there? Has that conversation been had yet?
We'll have to see what happens, but I mean, we may be back to where we're encouraging people to wear masks, we're encouraging people to get vaccinated, we're encouraging people to socially distance. So it'll be a challenge, but we'll just have to see when we get here. But part of the reason we did this is we have to feel like we're leading the charge. We have to feel like we're doing something to make a difference. And I think other jurisdictions, other cities, other counties are looking to us to see, how we're doing this to hopefully follow our lead. So I don't think this is going to be the end of it. I think you'll hear other cities doing what we're doing today.
Well, and let's be clear, we didn't do this anticipating that we were wrong. We do anticipate this is the right move by the judge, and that we, in effect, have now allowed for schools to do what they need to do, which is mandate masks for their young people.
I don't know if you realize, but all this looks like a movement where agencies and cities are on the same page against a governor that is trying to use everything that he has or everything that he thinks he has in its power to go against you. Is there any way that localities like San Antonio can get together with others in the state to make something even bigger against the governor?
Well, in effect, that's what we're doing, and that's what we have been doing during the entire pandemic. Counties and cities have been working together. And cities, the major cities in Texas have been working together as we established different best practices when there wasn't a playbook for the pandemic. So
and actually sue the state as a whole, as a group. I mean, there is strength in union.
Yes, there are, and the good news is there are abilities by other cities if they want to join us. There's a possibility of doing that. As you might expect, trying to get all the cities to join in on one collective action, that would take quite a bit of effort and, frankly, quite a bit of time. And again, it was the sense of urgency that caused us to act, the county and the city today, because we didn't want to, again, lose another day of not being able to attack the pandemic.
You talk about not wanting to lose another day. Let's talk about that positivity rate. Over 20%. A couple months ago, right around 2%. That jump cannot be understated in the slightest. Is that the biggest concern that led you all to do this today, knowing that school starts or is already started for some?
If I may. You brought up what's changed over the last few weeks. So you may recall that our overall risk level was at low just 5 weeks ago. And we've been reporting out systematically what's been changing in terms of our positivity rate. But the sense of urgency now, we're seeing the impacts on the local hospital system. We are mindful of the fact that there's a demographic, again, under the age of 12, that is not vaccinated, is not eligible as of yet. So we just want to make sure that we apply every measure, every mitigation strategy available to us now, like this act taken today, just to make sure we can protect students, parents, and teachers. So yes, that positivity rate is one indicator. We're looking at the hospital stress scores. We're looking at our average, 7-day moving average in terms of what we've been seeing on the ground. So we report out daily. We do make this information available to the public. So that's what we're using, at least anchoring to the science of our work to make these decisions.
Just to clarify, the school health directive, that is only to public schools. It does not cover private schools.
That's correct. But let me go back real quick on things that have changed. We have seen a skyrocketing in the number of patients in the hospital, so much so that we are now opening up facilities like what you saw yesterday with the infusion center to help relieve some of the pressure. You've seen hospitals also give up elective procedures. They are getting crushed in the hospitals right now. The other thing is that you have young people going back to school, 12-year-olds who are ineligible for vaccine. They don't have the luxury of choosing. They can't get the vaccine. And with the data that we have on the Delta variant and how dangerous that is, regardless, we need to do everything we can to protect them.
Look, all of us up here are vaccinated, double vaccinated. The very vulnerable people are the ones that are not vaccinated. And that's the big problem, because there's a 1,000-fold increase in terms of the virus in you with the Delta virus. People that like us that are vaccinated, we have much lower load. We only have it for a couple of days, where somebody not vaccinated has it 6, 7, 8 days. So it's the unvaccinated that the real problem is. And we're sitting here 6 foot apart, speaking to you today. That's also one of the other key things. But when you get into a classroom and you bunch up with 30 or 40 kids in one room, not 6 feet apart, and they're commingling when they're walking around, that's the danger point.
Mayor, Judge, are you all able to tell us how many children, pediatric cases there are in hospitals right now? Before, it seemed like there was a breakdown in ages over certain periods of time, but do you have data showing how many children are in the hospital right now?
We are working with our healthcare partners just to get the definitive numbers. So we do know that there has been an uptick in the number of pediatric cases reported by the local hospital systems, but we'll tally that and get back to each and every one of you.
I know one number in the Methodist Hospital. I think they were full with 240 some odd pediatric patients, but it's not all just COVID. It's VSR, did I say that right?
RSV.
RSV, I guess it is. It's a virus that usually starts in October. It started now. Kids are getting infected with that. We're moving into the flu season. Last year we had no problem. Why did we have no problem? Because we all wore masks and we all were very cognizant of that. This time it's not happening. So you're having a lot of children go into pediatric care units, not just because of COVID, but because of the spread of other viruses.
That's all we have tonight. Thank you.
Thank you.